Today we're going to be discussing human resources management. Topics that are in this meeting include a staff appraisal, grievance and disciplinary procedures, sickness and absence arrangements, criminal record disclosures, team training and CPD, and PDPs. So staff appraisal, why the basic benefit of the team. Staff appraisals are a really effective management tool for regularly evaluating how an individual's performance is against the targets that we've set previously, and hopefully just helps give direction to that person to achieve basically the potential and a greater success, and give a bit of guidance basically on development within the practice. Appraisals actually is a CQC requirement. We tend to have an annual appraisal, which basically pulls together all the little appraisals that we've had throughout the year. Now, as you're aware, the practice has come away from the very, very formal I comply based appraisal system to much more of one-to-one chats on a more of a daily basis. But then we have a slightly more formal system every 6 to 8 weeks where we give feedback forms, and we have obviously a discussion about areas to develop, how things have gone over the last 6 to 8 weeks in terms of targets and things like that. Also, in terms of feedback that's given to the team, we encourage basic feedback wherever we can do, both ways. We provide this through different methods, which include verbal, in writing, through WhatsApp, for example, and through emails. Okay, grievance procedures. Grievance and disciplinary procedures are put into place to make sure there's fair treatment of employees by employers. If a grievance is found, a procedure should be followed, and we have a protocol in place for that. We have both a formal and an informal system. Obviously, if it's just a small thing, that can be raised with Nicola, and we'll obviously try and resolve it the best we can. Obviously, if it's a little bit more serious, then there is a more formal pathway for that as well, and that's in our policy documentation. When it comes to disciplinary procedures, obviously if an employee displays unacceptable conduct or behaviour, there is a protocol in place for this. Now again, there is a full policy document. In terms of the actual process of a disciplinary procedure, normally there'd be a problem, there'd be an investigation. If that investigation determined that a disciplinary was required, stage 1 will basically be a first written warning. Hopefully that would be the end of it, but obviously if there are continued problems there, we could go on to a final written warning, and obviously that can then lead to a dismissal. Okay, sickness protocol. Sickness protocol, obviously everybody gets sick from time to time, but basically it's just trying to let us know as soon as possible. If basically you fall ill at work or you're injured at work, you need to report basically to one of the management teams as soon as possible. Ideally that would be Nicola. If you can't attend work because you're ill or injured, you should telephone Nicola. So please telephone, don't text Nicola, because we can't guarantee we've definitely received it by text. Before 7:15 on the first day of your absence. On any subsequent days, please let us know before 5 p.m. on the day prior. So if you're off on a Monday and you thought, no, I'm going to be off on Tuesday as well, if you can ring us up, let us know basically you are going to be off on the following day. It just allows us basically to organise some appropriate cover, whether that's asking other staff members basically to make rearrangements if possible, or whether or not it's going to be locum cover. Following basically letting us know that you're ill, we obviously need some details such as basically the nature of the illness or injury, the expected length of absence from work, contact details for you, and obviously any outstanding or urgent work that needs attention. So if you knew you had something to do on that Monday morning that was really important, obviously let us know so that we can basically make sure that work is continued. We obviously make a record of any sick absence, and obviously where we can do, we'll cover work and inform colleagues and clients, etc. That basically we're going to be covering it. Absence that's basically not been notified according to the sickness absence reporting procedure would actually be treated as an unauthorised absence, and obviously that can lead to the disciplinary proceedings. Okay, so Dbs checks. Dbs checks are a vital part of making sure that we as healthcare professionals are safe to work with the public, especially with the vulnerable adults and children. There are a few different levels of criminal disclosure. All the staff in the practice basically have an enhanced with a check on the barred list. Basically that pretty much pulls up everything in terms of it pulls up all of the other checks, but it also just makes sure that the applicant's not on an adult barred or children's barred list as well. And this is a type of check that is expected of us from the GDC. In terms of how often disclosures should be checked, there's actually unusually no formal guidance on this, but it's generally accepted about every 3 years would be appropriate. Okay, team training. Team training, CPD is obviously really important for our development. The GDC do have obviously a number of hours that we have to complete. So dentists basically have to do 100 hours of verifiable every 5 years, but we need to make sure that we don't leave it all until last minute. So we have to do at least 10 hours of verifiable CPD during any 2-year period. In terms of DCPs, a little bit different. So dental nurses and dental technicians need to do a minimum of 50 hours every 5 years, whereas therapists, hygienists, orthodontic therapists and dental technicians need to do 75 hours of verifiable CPD in a 5-year period, and you must also make sure that you've done at least 10 hours during any 2-year period. So again, you can't leave it all until the last minute. Okay, in terms of CPD, as you're aware, we've got all the nurses have got a paid subscription to the Pro Dental CPD website, and actually a really comprehensive website that's got courses on most subjects. If there's anything particularly you're struggling to find, obviously let myself or Nicola know. We also hold our annual CPR hands-on training. This is usually provided by the Tadcaster swimming pool team. Obviously other courses, if there's anything else you're interested in, obviously bring it up at your one-to-ones, and obviously we'll look into basically providing that. That includes things like your oral health, like radiography training, etc. Okay, personal development plans. Again, as part of the GDC requirements, we need to have a personal development plan in place. Now, the GDC website is actually really quite good for this, so it gives it some templates, but it also shows you what you need to basically include in a PDP. So you obviously need your details, you need some of your goals, what CPD you're going to prioritise. You need to basically review them with the GDC's outcomes. I'll talk a little bit about that in a minute. We need to complete your PDP for each of your cycles, carry out the CPD activity obviously within the year that you intend to do, maintain a record of all the CPD you've done. Ideally, obviously, want to review your PDP often. So obviously, as time goes on, you might decide that you don't want to do something, or you want to do something in a bit more detail again. It's just a little bit of record keeping to give an external person, and we find it really useful from a management perspective that we get an indication of what direction you'd like to take your career in. In terms of your CPD record for the GDC, you do need to record down the title and description of the CPD that you've done, the date that it was done, the number of hours that's shown on the certificate, and actually just pop these GDC's development outcomes next to it as well. Quite often, actually, the development outcomes are on the CPD certificate, which makes it a little bit easier for us. Okay, so these are the development outcomes. So we've got A, B, C, and D. Things that come into A, I won't go through all of it individually, but A's got communication skills, consent, complaints handling, raising concerns and safeguarding him. B, effective practice management, business management, teamwork and leadership skills. C's, clinical and technical areas of study, radiography, cross-infection, medical emergencies. And then D, ethical and legal issues, professional behaviours, and equality and diversity training. So basically, as I say, most of your certificates will actually kind of give you an indication of which of the A, B, C and D, and sometimes it actually can be a couple of them as well. Okay, so these are a couple of examples that are provided for PDPs by the GDC. So you can see on the top one, field of practice, it says they're a dental nurse, where the cycle is, where they work, any basically extra roles that they're interested in, and basically who basically they look after. When it comes to the actual PDP underneath, you just need to, and this is very personal to you actually, you just need to put some of the learning aims on the left-hand side, how that basically would relate to your work, which development outcome it links to, how it'll benefit to have at work, and then how you're going to basically meet that target, and when you're basically going to meet it by. So I'm just going on to the next page with a few more. So this is just a little example. So this person wants to do a little bit more on medical emergencies. They're basically going to do, it'll give them a better ability to manage emergencies in the practice. and then they're going to go on a course for it, and they'd like to basically do it in Q1 and do it annually. So other things they'd like to do, decontamination, there's a photography one there. So as I say, just basically a bit of an indication about what interests you, and also actually maybe some of your weaknesses as well. So literally if you think, oh, do you know, I'm a little bit weak on this topic, you'd probably pop that in your PDP, and then obviously put a plan in place for how you're going to strengthen your knowledge in that area. Thank you.